Hello, my name is Randy Pugh. I'm the chief at Lane LifeTRANS. What I'd like to talk about today is diversions, hospital diversions. What is a hospital diversion? During this time of the year, especially January, February, March, we have quite a few of your elderly or young people who get sick with the flu and have to either be transported into an ER or go to an ER for treatment. The downside of that is those ERs get very, very busy. What happens when an ER is full? Well, what happens is the hospital calls all the providers, the EMS providers, and they go on what we call diversion. What is diversion? Diversion means that ER is full. They have nowhere to put our patients if we come in. Now, technically, in the state of Ohio, there is no diversion law. However, what good does it do us or our patients if we take a patient to a hospital that is too full to render care to them in a appropriate time manner? So they'll call and they'll tell us they're on diversion. What that causes us to do then is go to another hospital that's affiliated to that one that we're diverting from, say a Mercy hospital, maybe St. E's downtown is full. They go on diversion. We would then transport either to St. E's Austintown or St. E's Boardman, which is tricky though. The problem is we might not know that until our ambulance is actually transporting in. In those cases, we do have to handle some complaints on them because now we have no way of contacting that family. We're already en route. We have no phone number for the family members that are going to meet their loved one at the hospital. And now we're not going to go to the hospital that we all agreed on prior to leaving the scene. The other thing that it does cause grief with is physicians. Some physicians don't always have the same privileges at every hospital. If we have to transport somebody that usually goes to St. E's Main to say North Side, that physician may not even have any privileges there. And then you also get into the problem with the insurances. The insurance may not cover that hospital. However, we as EMS providers are sort of stuck in the middle. If we take a patient to a hospital that's on diversion, we are going to wait. The patient is going to wait. They're going to be waiting on ambulance cots are not made for a patient to sit on and lay on for 30, 45 minutes. It at that point gets very uncomfortable. Not only to say that, but they're not getting treated either. And on our side, that is tying up the emergency vehicle at the ER, and it can't help anybody else then. So diversions are very, very important. There are a lot of times we know that when a hospital goes on diversion, they'll call every EMS provider and they'll tell us, and they usually take 2 hour blocks of time at a time. And in that 2 hours, they try to get patients that are going to be admitted upstairs to where they're going to go, or get them taken care of, treated, and released so that they have room to take others. Now, I will assure you, no hospital goes on diversion for cardiac arrest or trauma. If we have a trauma or a cardiac arrest and that patient wants to go to St. E's Main or North Side, those hospitals may be on diversion, but they do leave those two type rooms open so that we can come in and take care of the patient there.